The question is, what form of ascorbate or vitamin C do I recommend? And thanks for asking. I recommend fully reduced, 100% L form, fully buffered ascorbate, more particularly with potassium, calcium, magnesium, and zinc as the minerals, not sodium, and not acid. So not ascorbic acid, yes buffered, but 100% L form, fully reduced, fully buffered.
Okay, we had a question over here.
For Dr. Japp, at what point do you think lines are going to cross and our physiologic systems won't be able to keep up with the daily pollution?
If you follow the experts, it happened about 40 years ago and we're all dead. No, that's I wasn't trying to be glib. I think you've asked a profoundly important question. I think about that a lot.
Are we there?
No, well, we're real close. If you had a clock, like that clock of nuclear risk, there used to be a clock that would illustrate how close we were to nuclear war or something. If you had a clock of biological sustainability and survival, and you model it at the molecular level the way I have, you would put the hands 2 minutes to midnight.
So the children are the first telltale of
The children are the third generation. See,
the older people have only had 10 years of excessive.
No, the excesses started in the 50s. The excesses started in the 50s. We now have 1,000 to 10,000 times most of the toxicants of interest, like the phthalates and so forth. So things really have been going on for a while. It turns out the first generation is relatively resistant. The second generation, through a combination of hormesis and other things, doesn't show the adversity as much. Maybe their protective mechanisms are still working. The third generation, that's where you begin to see the problems, and those are the children of today.
When are the CEOs going to start getting sick?
When are the CEOs going to start getting sick? I don't know the answer to that, but I can tell you we now have Asperger's syndrome people running medical schools in major CEO corporations. We do. I have their names.
Next question. There was someone in the back who raised their hands. Go ahead.
Don't mega high doses of vitamin C cause renal stones and kidney stones?
Aha.
Oh, good question.
The question is, don't high doses of vitamin C cause kidney stones?
That was answered definitively in 1974 by Jaffe. And the answer is the following. A, if you take the wrong form of ascorbate and you have a genetic defect, you can produce a lot of oxalate, and calcium oxalate or mixed oxalates are one of the major stone matrices. If you are genetically defective, as was one individual who was reported in the Lancet in 1976, that one individual converted ascorbate to oxalate in large amounts. To the best of my knowledge, we have not found anyone else that has been reported in the world literature that does that. So there was a person with a genetic defect. Everybody else, including those of us in this room, will saturate oxalate production at 1 gram of ascorbate. So you can take 1 gram, 10 grams, or 100 grams, and you'll produce the same amount of oxalate. I have used ascorbate for the following: dissolving kidney stones. Dissolving kidney stones. It's a slow process, but it does work because ascorbate complexes with calcium and other minerals. So you can actually slowly dissolve kidney stones by giving enough ascorbate. That's the first point. The second point is that the oxalate risk only exists if you have a genetic defect. And you might have the second patient in the world who has that defect, so I recommend acting out of an excess of caution, which means after 2 weeks on calibration doses of ascorbate, measure the urinary oxalate. I've been recommending this for 15, 20 years. I've not gotten any calls from any colleague who had a super high oxalate value induced by ascorbate. Physiologically, the systems saturate at 1 gram. So 1, 10, or 100 grams of consumption will give you the same amount of oxalate in the urine. So there are many red herrings and myths about ascorbate, and they die like typical myths, very slowly. You kind of have to put a stake in their heart. But the risk of forming kidney stones from fully buffered L-form ascorbate is as close to zero as anything I know. Beyond that, let's not talk about ascorbate, but let's talk for a moment, as physicians, about stone formation. There is a definitive, successful treatment to reduce the chance of a further kidney stone in people at high risk of kidney stones, and the doctor in the back is shaking his head because he knows the answer. It's hydration. You can only form a stone in a concentrated urine. Anyone who's concerned about kidney stones, take a glass of water.
But make sure it's from the third aquifer down.
Right.
Question.
Yes, Dr. Crinion, you said that Parkinson's patients may have a high amount of lead. That was what I wrote down in my notes. Is that right? Did I write that?
Her question was, Parkinson patients have a high amount of lead. It was published by Dr. Howard Hugh. I still don't know how to pronounce it. Hugh.
Is it
Who?
He pronounces it
Who? Hugh. Who? Hugh? Who? Hugh. That individuals who had a high lifetime lead exposure had higher rates of Parkinsonism. I have found in a consecutive group of adults who have come to see me for chronic neurologic problems, the majority of whom were Parkinson diagnosis or Parkinson-like problems, all had very elevated lead, much higher than mercury, when we did a challenge test with them, and many of these were women, postmenopausal women who had lead burden because they were in osteoporosis. So those are the two pieces of association that I know of. Chronic lead, or lead in adults also is associated with decreased cognition, increased depression, and interestingly enough, a couple of the recent articles have shown that bone lead levels, as measured by fluoroscopy, not blood lead levels, is associated with increased risk of cardiovascular death and hypertension.